The city of Louisville faces a new epidemic.
WDRB's Stefan Johnson explains the problem and what's being done to fix it.
The problem is the city is losing hundreds, maybe even thousands of trees every year. And researchers believe there's a correlation between green space and life-threatening diseases. But they're hoping tree lines like this one at Wyandotte Park will address the problem.
I have diabetes. I had a heart problem, but they fixed it with my pacemaker.
Diabetes, heart disease, you name it, Diane Clifford or someone she knows has it.
Over the years, yes, I've had many health problems, many surgeries.
She lives in the Beachmont neighborhood just across the street from Wyandotte Park and the Waterston Expressway and is concerned about air pollution.
Or when they're over there in the ballpark playing ball or soccer, whatever they're playing, there's a lot of cars going up and down here parking, and there's a lot of exhaust on the street too.
University of Louisville researchers have the same concerns.
This is part of the national epidemic.
Dr. Aruni Bhatnagar is a professor of medicine in the Department of Medicine at the University of Louisville and says the problem is related to the number of trees the city loses every year.
Many years ago, we lost all the chestnut trees in the United States. After that, there is something called this borer beetle, so it attacks ash trees. So we have lost millions of ash trees around the country.
Dr. Bhatnagar is also part of the Green Heart Initiative, an effort to decrease the level of air pollution by increasing the amount of green space with trees and shrubs.
We had to plant large trees, so we planted almost 8,000 large trees and shrubs into this area.
The goal is to determine whether an increase in green space will improve the quality of life for people in areas like the Beachmont neighborhood and includes 500 volunteers.
We think that what we are testing, the idea is that maybe it'll decrease the levels of air pollution from the freeway into the neighborhood and thereby improve the health of the people.
I've lived here since 2009.
Diane Clifford is not one of the 500 volunteers, but glad her neighborhood is part of the study.
South End really needs it.
This is a 20 to 30-year study, but the results are available in 5-year increments, and so far, so good. With photojournalist Jonathan McEmber, I'm Stefan Johnson, WDRB News.